Associate Professor of Human Services and Counseling and Director of the Appalachian Center for Play Therapy at Lindsey Wilson, Jodi Crane. You are in the Brown Room of the Sue Craven Stivers Alumni House for Lindsey Wilson Conversations. And the way this works is you get to enjoy a beverage of your choice while discussing a topic of your choice. The beverage you have selected is Diet Coke, and the topic you have selected is play therapy. What is play therapy?
Play therapy is a form of counseling. It uses the natural therapeutic powers of play in working with clients of all ages, but predominantly with children. Since children have difficulty verbalizing what's going on with them, they tend to play out their issues and problems and communicate that way.
How long has play therapy been used by therapists?
Play therapy actually can be traced to almost any kind of mental health counseling or so on, goes all the way back to Freud. But as far as a profession itself, it's probably only been in the last 25 years or so that it's caught on, particularly with the Association for Play Therapy, which is the largest professional organization for play therapists.
Why has play therapy caught on in the last 25 years?
Particularly, I think, while I'm biased, I'd have to attribute it to people like Gary Landreth, who was my mentor at the University of North Texas. He's trained so many play therapists, and he's so good, almost like a guru, that because of his impact it's really caught on. Particularly like in early childhood education, any preschool teachers know that the best way that children learn is through using play. It impacts all kinds of development, physical, cognitive, social, emotional, and so on. Even just think about little kids when it's been raining several days and haven't had a chance to go outside and get all their energy out. I mean, they need to do those kinds of things. The primary benefit, though, as far as therapy goes, is that children especially, this is how they communicate their conscious and unconscious desires and wishes and conflicts and so on.
What is the one thing that surprises people the most when they use play therapy?
Just how powerful it is, I think. And I mean, I hate to use the word magic, but that would be, I think, kind of a good way to describe it. It's almost as if this works, and sometimes it's a mystery. I'm not exactly sure why, but you know, that makes it sound like it's not very scientific and so on. But in the end, it really does work. Well, when young children is the area that I like to focus on, and I think of that as ages 2 to 8. But play therapy can be used with any age, children, adolescents, adults, the elderly. Sometimes we may not call it play therapy, like working with an adolescent. They're not going to like to be saying that they're go and play with their therapist. In those terms, sometimes we call it activity therapy, that we're doing activities with the teenager.
You recently presented a paper at the Association for Play Therapy conference.
I presented with my mentor, Gary Landreth, and other mentor, Sue Bratton, and then one other professor, Mary Morrison, who is they changed the name, Southwest Texas, now Texas State University in San Marcos. And we presented on unique applications of filial therapy. Filial therapy is a form of play therapy. It was started in the 60s by a husband and wife who were trying to figure out a way to more efficiently to see more children in less time. So they developed filial therapy, and it is a parent education approach. So they would meet with a group of parents, and they taught them the basic skills that play therapists use, so that then these parents would do play therapy sessions with their own children. So in a sense, the parents become therapeutic agents. Now, to bring this to the presentation that I did, some unique things that we're doing with that is, for instance, the class that I teach on campus, an undergraduate course. I'm teaching my students these basic skills, and they're having their own play sessions. And in fact, I did a research study the first semester I taught that, and it was published in the Play Therapy Journal. They have also done filial therapy that was discussed in this presentation, where they train high school students to do play sessions with kindergartners. They've trained teachers, which makes so much sense. I so wish if I were president and I had unlimited funds, I'd make sure all teachers and school counselors were trained in play therapy.
Why?
Because the skills is really about communication, good communication, and about valuing people and treating them the way you want to be treated, all that kind of positive, nurturing kinds of things. We could really change a whole generation, I think, if that were to occur.
Associate Professor of Human Services and Counseling and Director of Appalachian Center for Play Therapy, Jodi Crane, thank you for joining us for Lindsey Wilson Conversations.